Hello, this is Group 9's final project, and today we're going to be talking about climate change. Climate change can be summarized as changes in the Earth's weather patterns that have been influenced by increasing levels of carbon dioxide in the atmosphere. The major factors associated with climate change have been greenhouse gas emissions. Human activity contributes to the greenhouse effect from the use of technology, more specifically industrialization and the burning of fossil fuels, deforestation, and the lack of governmental oversight. The changes of temperatures trigger rising sea levels, more droughts, and more frequency and strengthened storms. These variations in weather patterns affect everyone in terms of both their living conditions and health, particularly those living in low-income countries. The warmer and moist environments attract more dust, pollen, mites, and mold, which is all associated to the prevalence of allergic diseases.
Well, what has been done about climate change? Historically, for the United States, it's all been in the hands of the federal government. In the early to mid-1900s, those in cities felt the repercussions of industrialization with poor air quality and low standards of living. The federal government stepped up in 1970 with Nixon's signing of the National Environmental Policy Act. Other governmental organizations, like the EPA, also arose to protect environmental health. We use research conducted by our environmental agencies to observe Earth's weather patterns, where we can go as far back as 800,000 years before today to see natural fluctuations in temperature. This research could be considered our form of screening climate change, as this is an issue brought on by years and millions of people's emissions. Today, we have a multitude of environmental laws, but their existence doesn't promise the solution to climate change. Though, with the laws we have passed, they each have had a significant purpose in protecting our environment.
Educating the general public about the effects of climate change has proven to be very challenging, to say the least. Many misconceptions regarding climate change still persist in the minds of many Americans. For example, many climate change deniers refuse to accept that climate change even exists. Others deny that humans play a significant role in altering the climate. Public health practitioners can address these misconceptions by focusing on educating the general public and providing scientific evidence of climate change from reputable sources like the Environmental Protection Agency, World Health Organization, and NASA. All three of these organizations have information on the adverse effects of global warming on human health, such as rising sea levels, ocean acidification, and disrupted ecosystems. Additionally, healthcare professionals must be united in backing legislation that aims to reduce the effects of climate change by promoting renewable energy sources. Here are some websites you can visit if you'd like more information.